Hello, everyone. Welcome to our last webinar of our series, Innovation in the Age of COVID-19, a conversation with Colombian entrepreneurs. I am Lina Delgado, Executive Director of the Colombian American Association. During these webinars, we invited incredible Colombian entrepreneurs that are making a difference, not just during this pandemic, but also they are helping to rebuild Colombia's economy. Before I present our panelists for today's program, I would like to give a special thanks to Marcela Shine, who has been the moderator for this webinar series. She did an amazing job guiding a smooth conversation and discuss key challenges and opportunities entrepreneurs have been facing during their journeys. With us today, we have the Colombian startup Harper, which is a digital hospital winner of the HDI Startup Competition. I'm pleased to welcome German Jimenez, the CEO, and Estefania Lozano, the CDO. Thank you for accepting this invitation. During this webinar, we will learn from them that the key to success is not a straightforward path and doesn't happen overnight, but only with pure determination, we can achieve anything. I also would like to thank our partner for this program, the Center of Innovation and Entrepreneurship of Sergio Arboleda University. The Colombian American Association was the first binational chamber of commerce for Colombia established in the United States in 1927. We are a private, non-profit business organization that seeks to disseminate up-to-date information on economic, financial, and political matters, and promote commercial and cultural ties among the people of the two nations. I hope you enjoy this program, and Marcela, the floor is yours.
Great, thank you very much, Nina. It's been an honor to do these. It's really a lot of fun. Estefania, German, welcome. This is really exciting. I was talking to you both earlier and I couldn't stop thinking about everything you told me, so I can't wait to share it with our community. I'm gonna start simple and just ask you, why Harper?
Well, first of all, thanks everybody. Well, the thing you have to know is no one is really a doctor here. We all come from a medical family. I actually study medicine, but I get kicked out because I do not.
Out? Okay.
Yeah, because I do not approve Harper's biochemistry subject. So you can imagine where the names come.
Got it. So failure turned success. This is already starting to be one of my funnest stories yet. Why don't we, Estefania, give us a little bit of a background. What is Harper and what's the difference between what you're doing and other telemedicine opportunities?
Well, first of all, I want to thank you for having us today. And well, we want to clarify that we do a different thing from telemedicine, you know? Telemedicine is a doctor attending a patient and giving a prescription and maybe that's it, yeah? So what we do is we are a virtual hospital. We care for both of our public, which are doctors and the patients. We teach our doctors to generate, empathize, and with the patients, providing, sorry for my broken English, to provide both ways conversation, and also help them monetizing their free time. And also we have this role, we play a community manager role for them, for the doctors. In the other hand, we have the patients. We work to give them the possibility of having the control of their own health, you know, in the palm of their hands. We want them to have like a whole view, just like they check their banking account on their app, the bank app. So that's what we want for our patients, to have right here their health and the control, and ensuring this information is not lost when they change hospitals or cities. So they have in the palm of their hands all the information they need to be treated by doctors.
That's great, Estefania. So the patient journey that you're describing, you had to obviously get Harper into the hands of patients. Once
Mhm.
you've accomplished that, and we'll talk about that a little bit later, once they've received the app, right, the app, and they've downloaded it, what's the process? What's the decision making that they have to do? Is it an upfront fee? What does that look like for the patient?
Well, first we want to show them like a wellness hospital. Yeah.
Mhm.
Um, they got the subscription and they have a 24/7 medical doctor assistance and or a psychologist or a nutritionist by an appointment. Yeah. So our DNA as a company in which we transmit to our medical staff is to generate that warm conversation that I talked to you before, and which the doctor transmit knowledge and explanations, like an overview to the patient about the situation. We are not worried about generating or formulating a drug, but also inquire about, like the origin of the illness. The the premise of Harper's premises is to bring quality health to and medicine to everyone. So we create this policy in which a patient buys the subscription package and maybe it doesn't use it. It's a month payment. So if you don't use it as a patient, Harper doesn't keep that money or save that medical consultation, but we give it to people who is in need. That population that is not available to have this attention, the proper attention, and that's what we do. We
That's amazing. So rather than your typical subscription use it or lose it model, what you're doing is taking unused credits in essence and giving that to vulnerable populations
exactly,
in Colombia.
yes.
And so when people are registering, I imagine there's some sort of a process where they can apply also for additional help if they need, if they're in the vulnerable population and they need your assistance.
Yeah.
It's it's great to hear caring getting put back into the medical profession, right?
Yeah.
I thought that when I first looked at all this would be very transactional, but it sounds like one of the pillars that you're really focused on is empathy and thinking about the patient, not just physically, but also from a mental health perspective, which is
Yeah.
amazing.
And
Um,
nutrition.
Right. So prevention is important, and you've put that all into the model that you've created.
Yeah, that's a
Um,
premise.
so
Prevention.
what I think about now is how fast did you have to put this together, and how long had the company been founded before the pandemic hit?
Well, I think Herman could answer that better.
Okay. Well, the real the real fact here is we don't have a lot of money. Yeah. So we start to think about how we can help all the people around here. Yeah. So we decide to create this because more than 2,000 people, or, excuse me, more than 2,000 doctors are unemployed right now in Colombia. Yeah. And when you see the patient, they have to wait more than 3 days to have an orientation for a medical doctor. Yeah. So we start to year and a half, we start to create a model that can help us because when you have a startup, the thing that kills the startup is the cash flow. So we first resolve that, and we have a model that let us live for a decent time and also make money for doctors and have a pretty decent price for the users. So we don't have no, we don't develop technology. We just develop a presentation, and we go to the market and say, hey, we have Harper. This is going to work like this, like that. So they give us feedback, cheap feedback actually, but feedback that works tons for us. And when we put all together, we start to develop technology. Yeah, we start with uh, artificial intelligence and everything after we had the feedback and everybody say, okay, that's nice. You can have an MVP. Uh, when we do that, we just say, okay, it looks like it's working. We have 100 patient per every 10 days. So we say, okay, it's
So
growing
give
fast.
me give me a time frame. When was this? What time of the year was it?
It was between June and September. In September, we start to develop technology.
Mm-hmm.
And pandemic came in March. So we just have 4 months to have an MVP and just put it on. And
Talk
when we
about rapid development cycles, huh?
and when we launch it, we actually don't have any doctor or patient. We just be there in Google and iOS and just wait. And one night we got 200 doctors that they want to be on the in Harper. I mean, was really amazing.
Herman, you mentioned that you did some early user, like focus groups, in a presentation model rather than build something first, hoping they'll come, right? Did you find that that also helped you launch because you had those conversations with, I imagine, hospitals, doctors, and patients, so that on day one you can go back and say, look, we did what you said and what you recommended. Can you be one of the first? Did you find that was really helpful?
It was really it helps a lot for doctors and help tons for patients. You know, the patient says, hey, I want to do that, I want to do this. So we create two different models or business models that allows user to use on demand and use that mensual subscription. Okay? The difference lies in first the price. For on-demand model, it costs like $6, and the subscription is like $4. Yeah. The second difference is in the subscription model, you can add 3 more people to your subscription, like Netflix. So it makes a collaborative economy model in which one you can pay a month, your wife can pay the other month, or your friend can pay the other month. So you don't feel really that you are paying something really expensive. Actually, it is pretty decent price. $4 is a lot of.
Well, Herman, I think that's so important because as Colombians, we we live in a community environment, right? We take care of our families, but what I love about that is we also have family members outside of the US, and if we can help them as immigrants, right? And say, look, you're still part of our family. You can use Harper to log in and get some quick medical advice. That really accounts for so much of who we are as Latinos, right? So I think that's fantastic. And the fact that you can compare it to a Netflix model where you just add a family member and keep adding, that's really easy to understand for anybody who's using your service.
Okay.
That's great. So you managed to put together an MVP, go live, the pandemic hits, and all of a sudden you started growing. Where did the funding come from? How did that all happen?
Okay, we just see an opportunity. We see the opportunity to participate with an accelerate. But just to be fair, we just have 10 doctors and 5 patients, the 5 co-founders. So, so the outlook wasn't the best, really. But however, we decided to take the opportunity and decide to create a very simple plan. And the plan was in 2 steps. First step, we work a day just to grow the startup. And the second step was just make all the accelerate is asking you at night, because at night you can grow your company, you can go to appointment, you can convince that they have to use Harper. So at the end, looks like it works good for us because we get choose by the accelerated, and now we are growing faster. We have a plan for have Harper in 27 cities in Colombia and an international markets for the migrants that you say, because when you help the migrants that they are winning, they are earning money in dollars or in euros, it is cheaper to have a Harper plan for their or their families.
That's fantastic. So you went from, you started with your own dollars, right? You guys all, the founders all pulled together dollars to get the initial MVP going. You were
Yeah.
planning on doing that, testing, then going to market, but because of everything that was going on with the pandemic, you were able to go to market, get your seed round, right?
Yeah.
Through the accelerator, and now you're pushing forward on an expansion plan.
Yeah.
So what's the user base look like today? What are the numbers?
I mean, we have the capability to attend. No, we orient 500 patients a day,
Wow.
and
That's your capacity, or is that what you're doing today?
no, it's our capacity. We are
Wow.
almost half, and we are growing. We can grow in 24 hours 100 megs if we don't have the capability,
Capacity?
the capacity. So
Mm-hmm.
we grow really fast, and actually we have a lot of doctors that are waiting to get in Harper to help more people.
So let's talk a little bit about going back to those differences that Estefania mentioned earlier, right? So, you know, we talked about empathy and making sure that the doctors are trained to take the time to speak to their patients and learn a little bit more. You know, here in the States, we're hearing more and more about functional medicine and taking a more whole body approach to medicine. How have doctors reacted to that? You've given them an opportunity to work from home. You've given them an opportunity to fill hours that they weren't using potentially while they're at practice. So you're helping the Colombian economy expand, right, by providing them more hours of work. How have they reacted to your training and your ability to help them go beyond that 30-minute patient session? How has that been?
I think it's
Well, we think we have been very lucky that we have got these young doctors who are open-minded to that. You know, here that medicine, the how did you call it? Functional medicine is like the new black. You know, it's they are open to that. They are, I don't know, maybe it's like a new thing, a new movement that it has been going on here, and they are open to that conversation and to understand the whole environment of the patient. So yeah, it hasn't been a lot of work from us because they are open about it. Yeah.
The other thing that really struck a chord for me, German, when we spoke about your differentiation was you mentioned the word AI. And I know for me, every time I go to switch a doctor, especially for my kids, it's like, you've got to get the medical records, you have to switch, then you have to explain, and then you forgot to tell them you're taking a supplement. And it's really on you to own that information. That's something you'd like to change, right?
Yeah, we just discovered that the data for all the patient wasn't very helpful, because when you fill the medical record, you can be treated in Missouri, for example, and after that you go to Montana, and you have a problem right there because you have to fill again everything and you can forget something. So here you carry the data with you, and the doctor can, the doctor will have a much better tools to make a diagnosis.
Herman, how is Colombia treating patient confidentiality and data protection? Because I know that's a really big deal here. People are starting to use it. I'm starting to use ZocDoc to make my appointments, right? And I think there's more trust happening there, but tell me a little bit about what it had to take for you to build that trust and the protections on the data side.
Okay. The first thing is the patient have to agree to share the data, and we don't share the data with someone different than the doctor. Yeah, and when we are making some studies, we make like no name. We just take the name out, and we make all the study, and we know all the patient, but we never say it's Marcela that is having this and this problem, or it's Stefania, or it's Herman. No, we just make anonymous.
Okay, so you're doing aggregated data so that you can inform doctors on trends and things like that. And then you have your technology that's using data protection to make sure that that data is not leaking anywhere.
Yeah, and the data is always for the doctor. I mean, you can see me here, and you say, oh, Herman he's good. He's 5'4", and he weighs like 200 pounds. I mean, you're a big man, so you have to take this and this and this and this and this, and maybe all doctor can see that. So we just give them tools to make a better diagnosis.
And are the tools inside of your portal?
Yep.
So is there a web portal for the doctors, or are the doctors also on an app? So it's a web
No,
portal for the medical professional.
Mm-hmm.
Okay, and then the patients are on an app and can also, I imagine, log in online. One last question on this side, and then I want to think about the future a little bit with you because this is so incredible. I break my, so I have a relationship with Harper. You are my doctor and my hospital. But I need to physically go to a hospital. Is there a card? Is my Harper card? How do I check in to keep the relationship with Harper and the doctors within my network when I have to physically go somewhere?
We connect Harper with hospitals, yeah, and the information goes to the hospital. We are doing that just right now.
Mm-hmm.
Yeah.
So that's something you're working on today.
Yeah, we are working on that.
And do you have to establish a partnership with every major hospital, or in Colombia, is there a centralized system that you can plug into? Tell me a little bit more about the industry there.
In Colombia, there is no central information. Every hospital have an information. So we have to make a relationship with all hospitals in Colombia. We are spoken more than 1,000. Yeah.
Mm-hmm.
But we are developing a relationship really fast because of the accelerated. And we just connect the database of the hospital with Harper. So we just are a center of communication for all the health system in Colombia.
Okay, so they'll get a portal login in essence to be able to access that information. Mm-hmm. I'm thinking about, you're talking about partnerships, and then of course there's marketing. Give me a sense of what your team looks like today and what your expansion plans are now that you've been funded.
We used to start 5 people, like 4 months ago. We are 100 people right now. We are growing so fast, and we are creating the round for invest, and we hope that we have 500 people working and develop more algorithm to democratize health.
Give me a quick summary of either the 100 or the 500. What are percentages? We're talking, developers is what percent of the company at this point?
We are talking about like doctors has 60-70%, and technical team is like 20%, and the 10% of
sorry, what was the first category you said?
Doctors.
Okay, so the doctors are in essence freelancers.
Yeah.
Okay, so you've got your doctor group as one of your user types and freelancers. On staff, what does it look like? If we take the doctors out, well, who's on staff?
Looks like 30 people.
Okay. And is it 50% developers and then everything else that it takes to run the company?
It's like 20% developer.
Okay.
and the rest is just making commercial efforts and all the
Operations, marketing, sales, all that good stuff.
Well, we have like three, how you say that? Like the revenue area, the technology,
Yeah.
and the other one, I don't know how it's called. Like process,
Yeah, operations.
yeah,
So you've got
operations.
operations,
That's it.
technology,
Yeah.
and revenue.
Mm-hmm.
And tell me how it's been managed. You know, we're talking about running startups in the age of COVID. Estefania, you're in Medellin. Germán, you're in Bogota, right? Where else do you have team members?
we have team members almost in 6 cities. We have Bogota, Medellin, Cali, Cúcuta, Bucaramanga,
Bucaramanga,
eh,
Zipaquirá,
Zipaquirá.
Calilla.
Cali. I
Yeah, I
mean,
mean, the
all
impact, right?
from
If you're
everywhere.
when I think about the impact you're making with the doctors themselves and going from 100 to 500 based on the growth on the patient side, that alone is such a massive impact on our economy in Colombia. I can't congratulate you enough for that. Having doctors in my family who don't have enough work and or are working with, you know, below average salaries because of the situation there. This is such a massive impact. I'm so excited to hear more about that. So that leads me to the future a little bit. So you've got your traditional medicine, you have mental health. We talked about prevention, which I think is great because then there's other types of doctors that sit within the realm of prevention. What else do you have coming up?
Well, we are going to bring to Harper dermatology, pediatrics, and plastic surgery.
Uh-oh. I don't have to
I'm
use my
glad.
Zoom lens anymore. This is great. My Zoom filters anymore. Tell me tell me a little bit. I'm like signing up on my next computer as we're talking. How are you going to roll it out? What's your rollout plan? Do you have to get a Series A? Are you going to be doing a Series A next?
Yeah.
So
Yeah.
it's Series A, and then you're going to start those. Give me a little bit of your go-to-market thinking around those additional verticals.
Right now, we just pull three big areas that are psychology, uh,
Nutrition, lab test.
lab test, and we are just developing that. And after we end it, and we just say like it's going to be in 2 months, we just start to bring pediatrics, dermatology, and if the investment comes, great. And if they don't yet, we still keep growing so we can get more invest.
Okay, so you'll use either cash from the subscription model as it builds, and then a percentage goes to development, and then a percentage goes to growth.
Yeah.
Yeah.
Okay. What you mentioned earlier expanding outside of Colombia. Are you going to, again, look, we would all love as a startup, we want to do everything, but if you're not careful and I think it's the first thing you said to me, Mom, was like cash management was your number one concern when you were building this out and thinking through your model. So I'm going to go back to that point because I couldn't agree more. As an investor, I've seen so many companies with great potential die out because either investors were done reinvesting. I mean, COVID's been a massive concern around those things, cash management. So you can't do it all. I know you want us to think you can, but I can't. So again, what's the priority? Are you looking to expand outside of Colombia in South America first, or are you going to stay within Colombia and then tie into the family Netflix subscription model? Like, what are you balancing here? What are the different balance points you have?
Just to say the truth, we are just making A/B test. So the user will say, okay, you will grow here in Colombia or you will grow in Latin America. So the market will say where they want us. They want us in Colombia, they want us Latin America. I don't know. Estefania is running A/B testing every day. They have like 5 or 6 experiments a day. just to say we have to go Bogota, Cali, Medellin, or we have to go Miami, or we have to go Madrid. The data always is the driver. So
Okay, so walk me through that thinking, right? So Estefania, you get a group of A/B testing, the answer is Miami, right?
Mhm.
So what's the next step for you, Edmond? Like, is it partnerships so that you can actually potentially get a patient to a facility, or because again, at some point, somebody physically has to go somewhere if there's something serious going on. So what's the next step in that expansion plan in order to take the entire journey with a patient from figuring out what's wrong to potentially having to go get a test, an MRI, et cetera?
Okay. In that order, the first thing is we just make telemedicine just to help, and after that we just make a lot of partnership with another hospitals, and we try to make a better price for the people we are sending. Yeah, because we are trying to democratize this the health, because we think it's a fundamental right. Yeah, so we are trying to help everybody. That's the truth, and we just make all the agreement with hospitals, or even just thinking and bring them here. Yeah, if they're not illegal migrants, I mean, because
Yep.
we will have a problem.
All within the legal bounds of everything that you're doing. We'll put that disclaimer up front.
Yeah.
That's fine.
And so we can help. That's what we want to do.
And we would love for you to fix healthcare and immigration reform all at once. That would be really amazing. Okay, so it's really first, at least outside of Colombia, it's getting them the help first, identifying some problems, and then eventually expanding into the same partnership model that you've been able to build in Colombia so far.
Yep.
Insurance. How have you dealt with insurance? What's the deal there?
Okay, one of our partners is an insurance company. It's a big insurance company. So we are just making all the arrangements so we can help or make the orientation for them. When you have insurance for life or something, and you want a doctor, you have to come Harper.
Okay. Question, in Colombia, are there a lot of HR partnerships that you can go after as well? Service companies, like in the United States, we have TriNet, we have ADP, we have companies that work with corporations to support employees. Is that a tactic that you can use in Colombia as well?
We are using, especially just go to the company and say, hey, this Harper, you can use it for all your employees. It's not as expensive as insurance, yeah, and you can give them health.
Okay, so you're looking for, so in addition to, you've really got that additional model then, because you've got your patient model, your medical doctor, and then you've got a corporate partnership model that you're going after as well.
Yeah.
Yeah.
Where have you seen the most lift in patient enrollment? What effort has led to the most enrollment, Estefania, so far with your ABCD testing that you have going on?
Yeah, it has been like a whole journey for that. I think both of them, like, you know, maybe the when you talk about like B2C, I think a key for us is to educate this country now, because we are working on that now, how they can have the control. They have to understand what we do, and after they understand, we sell. You know, we sell like peace and that I want them to be sure they are going to be attend at all levels, you know. And yeah, education is that main thing that work for the both of the cases. in the B2C, it's very important to let people know this is a new thing. Yeah, maybe not in the United States, but in Colombia, it's a challenge to people beliefs about this. So yeah, I think education is what you can afford, like everything.
And as part of your marketing, and again, I'm not even going to call it marketing, it's really relationship building. You told me earlier that you're using content as a part of the experience, right? The community experience. Can someone join Harper just to be a part of that learning community before they buy a subscription, before they actually create a paid relationship with you?
In what way? I'm sorry.
Can a patient come in for that education when they join Harper without paying you? So in essence, it's a
Oh
free
yeah.
community.
Well, we have now like they can check the app and fill their hospital records, their medical records, and have like a track. It's like the beginning of the fun. We have to give them show them a little bit of what they can have with us as a subscription.
Great.
So they can do that, and we are working, and I hope it's going to be very very soon, like little test or like a gaming thing for them, but it's help, it's a serious thing,
Health related,
but a
yeah.
fun thing to that's a part of the education, to know they can know themselves, of course with a doctor, like following them, but they can have they can understand. That's what we want, understand. So yeah, we give them without paying a little bit of what they can have with Harper.
That's great. So,
And, I'm sorry, and people can have a quick test for daltonism and other stuff like COVID or something else, and it is going to be for free. We are launching this in 5 to 6 weeks, so people can make quick tests every day.
all right. So do you mean you're talking about a questionnaire that they
Yes.
can go through to make sure that they don't have whatever symptoms they're feeling are not resulting in something specific? So
Mm-hmm.
it's like symptom gamification. I hate
Yeah.
using the word for
Yeah.
medicine, but yeah.
Yeah.
What other innovative ideas are coming down the pike? So you've got an expansion in the type of medicine, you've got these questionnaires, or in essence, a way to drive people to understand their symptoms. What else are you doing in the next 6-8 weeks that you've been surprised that you've been able to accomplish so quickly?
We are just developing a lot of things. I mean, the technological team is making like 3 or 4 things at the time. The big thing here is we just closed a deal with the biggest lab in Colombia, so people can go to make their exams or their test. I mean, in all the cities in Colombia. I mean, if you want to go to have a test, you can go in Bogota, Cucuta. I mean, they are the biggest lab in Colombia. So that's pretty much that's a big achievement for us because we are still little. I mean, we are not rock stars. We are just little, but everybody's looking us.
I don't know, Edmond. I think we're all going to argue that you guys are rock stars with everything you've managed to accomplish in such a short amount of time. It's really. Let me ask you a question. Going back to, because this is sitting in my head, the vulnerable communities that you talked about earlier.
Mhm.
Are you thinking about, or have you spoken to technology partners? There's investors on the line watching this. What other partnerships are you looking for to help expand your ability to help vulnerable communities, right? Because I can tell you, I've helped children in vulnerable areas in Colombia, and one of the biggest issues we had with education was their parents didn't have access to a smartphone, right? They're still using flip phones. So what other technology support or partnerships do you think would be really useful to make sure that you can extend your affordable solution into more vulnerable communities? Is there an ask that we can put out to the community for you?
Well, yes, when we go to that people, the first thing we create is an app that doesn't weigh too much because their cell phone are not big enough to support a big app. Yeah, that's the first thing. And they don't have internet and they don't have smartphones. So we just want to work with all companies that support that give smartphones or internet so that people can have access in real time. We are working on that. We want all companies for sure come and say, hey, I have this and or I have that, I can use it or I can put it to, not for us, not for Harper, not for income for us, not, it's just for the vulnerable people that don't have the resource for pay them.
Yeah, and Herman, what about, have you thought about key access points, right? Like there's an ATM where you can go get money. Have you thought about doing partnerships for some key access points for people where they can, you don't want to be in an internet cafe talking to your doctor, but are there other key access points that you've thought through where you could potentially expand your reach while the technology becomes available to more people?
Well, actually, we are working on a deal to all the grocery stores have a cabin where the people can come and ask the doctor in a privacy space. But we are working on that.
Yeah,
It's not
no
done.
doubt your project list is really long, but again, I'm thinking about how many failure points you're solving for across medicine, right? It's just such an amazing way to get that. All right, I'm going to open up a Q&A here because we're running towards the end. One of the questions is, how did the pandemic help your company? I think we know that it's accelerated your development tremendously. Another question that's coming in is, how are you negotiating contracts with different vendors?
Like,
I guess
that.
I imagine they're not specific, Angela, but I'm imagining, did you set a rate with doctors ahead of time? Did doctors have to agree to a specific rate that how did you deal with that?
Okay, we just create a model that make all doctors more money than they make by giving one orientation in their companies. I mean, we pay 2 times more than the health system pay in Colombia.
Wow. Fantastic. It's funny. There's another question here. It says, have you been able to help the community during the pandemic? If that's not eye-opening enough that you're already paying more for this valuable service on the doctor side, we've talked about the vulnerable communities that you're affecting. And so I think you guys are really focused on the social responsibility aspect of what you're doing. That leads to another question, which is, where are the developers for the app located?
They are in all Colombia. I mean, we have a team in Cali, we have a team in Bogota, we have a team in Zipaquirá, we are looking at a team in Cucuta, that is our city.
Fantastic. I think that's really important to people, right? Like making sure that you're trying to not only create a beneficial workforce for the doctors, the benefit for the patient, but that the people within your company are also within Colombia. As this series has proven, right? We have such amazing entrepreneurs coming out of our country, and it's so great to see you staying, and more importantly, that you're building your workforce inside of our country. I think that's something that really needs to be commended, because so many companies are saving money by shipping out We have amazing talent in Colombia, so I'm happy to hear that you're keeping that in.
We have potential here. We don't have to go Silicon Valley. I mean, I will love to be there, but in Colombia we have all the potential, and we have a really good person and really technical people that really can make change. I mean, technology here is great, and we pay what they deserve. I mean, we are not making payments under the law or something like that. We just pay what they really deserve.
Herman, with the shift that the pandemic has created and the fact that so many people were forced online, how do you plan on continuing to create a relationship, a community across all your different constituents? What are you thinking? Are you thinking, online events? Are you thinking of eventually doing something beyond the grocery stores? What else are you thinking about post-pandemic to bring the company back into the real world?
Well,
Have you guys
Stephanie,
even thought about that yet?
yeah, Stephanie, I have a homework. I don't know how to say it, but she's creating a cart for all the supermarket, like Carulla, like his Target for you guys, so people can get his car, so they can have access to health when they need it by cards.
Great.
It's like a Spotify or Netflix card. That's what we want to be everywhere.
Fantastic. I think one other thing, you just mentioned Silicon Valley, right, Herman? And what I found most interesting beyond the price and how honest you're being about the pay model and transparent was the extension, the family extension outside of Colombia or outside of Latin America, because we are a nation of immigrants here in the States. Yep. And I think it's really important that we close with that perspective. I'd love to hear you guys talk about your plans for extending beyond your border or our border in Colombia to those family members that are here in the States. I feel like we didn't pay enough attention to that. So I'd love to hear your plans for that. We mentioned Miami. What goes beyond that once you get all of this A/B testing done?
Well, we have been working with some people in Spain to understand the market, also in Australia. And yeah, what we want is to, maybe because of the pricing, for immigrants, it's really expensive, really cheap to get it here, and to make them like heroes, like they are still protecting that family that is still in Colombia or in their countries, because we want to expand to South America and Central America. But yeah, that's what we see. Maybe right now I don't feel I don't want to introduce a lot of what we want, because we still working on it, because we want to set the path here in Colombia, and then we follow the same, or like copying the same in outside, but the market is different everywhere. So we want to build with that I don't know, pattern, how you say that like we want to follow that, but building on the each country's story, and culture.
Right. So you want to make sure that you're looking at all of the local needs.
Exactly.
Before you start expanding.
Yeah, we used to the word, we use a lot the word obsession, because we are obsessed with users. We want to give them what they need and not what we think they need, what they actually needs are.
Yeah, I mean, no bigger need than health itself, right? Yeah. As whenever we speak to anybody, it's like, health first. There's a question from the audience about any partnerships or conversations with the government. Is there anything going on there at this point, or have you kept it 100% private and there's no crossover yet?
Well, in the race of trying to be the biggest startup in Latin America and in health edge, we are just trying to make some deal with the government. But the truth is, it's not easy, yeah, because they looks like they don't want to help all the people. It's our first impression, because we put Harper for free by the pandemic to the government, and they don't say nothing. I mean, you have all the technology, you have the app, it's for free. Take it, use it, and they just don't say nothing. I think they don't want do it, or they think we are just joking, or they think we don't have all the technology to cover the country. But the true fact is, now we have the capacity to support 50 million people in Harper
At the same time.
at the same time.
So let's for a second assume that there is a model where you could give free access through the government. How would the company support that? Sponsorships? What would the model be there?
Data.
Data.
Data driving is the model always. I mean, if the model is going to be free for the government have to put the doctors, because they already pay them. I mean, there is a lot of doctors right now in their house, because they can go to the hospital.
Mm-hmm.
They can use Harper, so all community can be using Harper right now, and the monetization is by data, by making studies, by go to the pharmacy and say, hey, you are making this drug and you don't have to do it because the 25% of the population don't use it. You have to use that. That's the big business.
Yeah. I think the fact that you're centralizing this information in a secure way, and helping doctors make recommendations or create conversation beyond what's, like you said, I've got this on my face, but the problem may be somewhere else. The fact that you're informing that with data is really what makes this opportunity as a startup so interesting. Because you're right, AI really helps cull through data faster, and you're not removing the doctor's human capability of making a decision for or helping their patient through their decision making, but you're at least putting more data in front of them so they could look more broadly before interpreting what they're seeing with their eyes, which is amazing. I can't think of any medical appointment that I've been to where they're keying in data based on what I'm telling them, hoping to get a better read for what my problem might be. And I do think that that's one of the greatest opportunities that you're giving both the doctors and the patient, which is really amazing. Are there any other, and as an entrepreneur, I always have to put this out there. Are there any other asks as a startup for the industry? Connections, introductions, like what are your asks from those of us that are professional entrepreneurs looking to help build your startups? Is there anything else that you're like, you know what, it would be great to meet these types of connections in these types of places? I know the accelerator did a heck of a job getting you guys kickstarted, but I'd love to hear if there's any other ask that you have of the Colombian American community that you're speaking to.
We love to have a connection with all the people that treat with migrants, so we can go and tell them, hey, there is an app that can help you with help you don't have right now. So we can go there easy and help more people. The thing here is we want to help. I mean, Harper is for help people, for democratization, the health, because we think that is a fundamental right. And in that order, we just want to get there, get in the communities, help people, and growing fast to help more people.
That's fantastic. I think there's some really, and you and I spoke about it earlier, there's some really neat partnership opportunities that I'm definitely going to explore with you after the call. But there are so many nonprofits here in the United States that are focused on helping our immigrant community, that I think it's a great, with your multifaceted, multi-talented A/B testing capabilities, Estefania. I think you'll be able to look at some key partnerships in the nonprofit space that can help guide some of that thinking. And I think the opportunity for you to expand your user base and to really help the Latino community potentially globally is just limitless at this point. I really commend the technology you've built, and more importantly, the heart with which you built it. Because I can tell that that's really been an important part of the mission you've set out.
I will have to compliment what Germán said, and everyone, we think that health is not only like physical, what happened in the body, it's the whole environment of how the people live. Yeah. So we are open to everything that can help that people to feel safe, to feel secure, and sell that happy life, with which is not the truth is that it's not money on fancy lifestyle, but it's to be healthy in every way. So if there's someone who had an idea, maybe it's not in the medical industry, but it can help people a healthy lifestyle, it's welcome. We are welcome to hear a proposition.
Great. Well, congratulations to your entire growing team. Because going from 5 to 100 is, crazy enough. So your accelerator gave you a heck of an opportunity, and it's been really a joy to hear your story. Lina, thank you for inviting these superstars into the program.
No, thank you. Thank you, Marcela, again for moderating all these webinar series. And we couldn't finish this webinar series with Harper, with what amazing company, and these two rock stars, because you guys are a rock star. It's amazing see a company that, of course, a company that you are going to think on making profit, but since the inception, you guys are thinking of social responsibility, helping. And one of the things that I heard so many times from in this panel is helping reach minority communities, undocumented communities, especially in Colombia. So that is amazing. And I wish you all the success, and count on us and with the Colombian American Association for anything that you need here in New York or in Colombia, now that we can connect from people from everywhere. And I hope to see you again soon, so we can hear an update of what's happening, what's going on. And again, thank you for such amazing company, and thank you for helping the community and the health system in Colombia. Thank you so much.